New recommendations to treat childhood obesity now include weight loss pills and surgery. That's according to the American Academy of Pediatrics, which updated its guidelines for the first time in 15 years. Dr. Dyan Hes joins me now. She's the founder and medical director of Gramercy Pediatrics in New York City. Dr. Hes, how significant is this move to treating childhood obesity with both weight loss pills and surgery?
Well, they have been around. Some of the medicines are more recently approved for the use of ages 12 and up. Surgery we've had, it's not new. It's important because now we have guidelines. We have guidelines that we hope the insurance companies will recognize and actually start paying for obesity care and not consider it something cosmetic. I think that's our biggest challenge. We need the pediatricians to be able to care for these kids. We need to be able to write prescriptions, but I can write the prescriptions, but if they don't get filled because they're not covered, my prescription is useless. And I can tell you, I've been doing obesity medicine for 20 years in pediatrics. I'm one of the few people, I was one of the first. I can tell you that 1 out of 10, maybe, of my prescriptions get covered, 1 out of 10. So, it's exciting. Hopefully the insurances will follow suit and recognize that they need to pay for these drugs. But, drugs is not the first line of choice. We have to talk about lifestyle modification and environmental situations that are leading to obesity in children.
So if 1 out of 10 are actually taking your recommendation, and then that must be just a cost decision, I would imagine. What's the practical effect of that on the health of the other 9 out of 10 who aren't able to follow your recommendations?
It's so silly because it's a penny wise, a pound foolish. Because if my patient goes on to develop diabetes by the age of 14 or 15 and they have type 2 diabetes, then that insurance company has to pay for their lifelong drugs, diabetic medicine, hypertension, heart disease. Whereas if we can prevent diabetes, it would be so much more cost effective. But we know that the U.S. healthcare system is broken. I can't refer a patient to a nutritionist unless they have type 2 diabetes. So I need my patient to get type 2 diabetes in order for their insurance to cover a nutritionist.
So do you think that that insurance companies now have changed their mind? And give me a sense of your understanding of how parents think about obesity. In other words, is it a cosmetic? Is their first reaction that it's a cosmetic issue and not a health issue? And where are insurance companies, in your understanding, in terms of their assessment of obesity as a medical a challenge as opposed to just a cosmetic one?
Well, I can tell you in pediatrics, there are certain companies like Cigna will never cover any GLP-1 inhibitor that I write. It will never cover any appetite suppressant that I write. It writes back, this is non-medical, this is cosmetic. We know obesity is a disease. It causes hypertension. It causes inflammation in our circulatory system. It causes worsening asthma, joint pain, depression, anxiety. These children are suffering. They have so many comorbidities. Now, the question you asked me about parents, this is a really sensitive topic because some parents feel very judged when you mention that their children are overweight. Some parents themselves are overweight, and then some doctors are overweight, so they don't even want to bring up the topic. So this is such a complex issue. And I applaud the AAP for writing this article, but I do feel that is a little, it's somewhat naive that a general pediatrician can manage all of this. I really think it takes a pediatric obesity specialist.
And what ages are we talking about here, doctor, in terms of making the decisions that are best to handle this issue before it starts to grow into some of those larger problems that you mentioned?
So the article is for ages 2 and up, but general pediatricians can manage kids who are overweight. I saw one actually very overweight, and we discussed about overfeeding and snacking and what the grandmother's giving while the parents are at work. It's, for me, talking about nutrition is preventative, right? I don't want my patients to get to the point where we have to treat obesity. But the truth is that, 20% of our patients are overweight or obese. So we're starting at 40% of adults. So it's always going to be part of the conversation. It's hard for general pediatricians to incorporate this into our regular visit when we're doing school forms, asthma forms, sports forms, depression, risk-taking behaviors in adolescents, sprained ankle. So it's if you ever had a discussion with your physician about eating healthily and a healthy lifestyle, it's not a 2-minute conversation. It's in depth, and you have to find the right family that is willing to hear you out and make positive changes. And it's according to the article, a successful intervention takes 26 hours of face-to-face work with either a physician or a healthcare practitioner.
Okay,
That's a lot of hours.
That is indeed a lot of hours. Dr. Dyan Hes, thank you so much for being with us.
Thank you.